Welcome to One-on-One, the Daily Items weekly digital program featuring Susquehanna Valley newsmakers interviewed by Daily Item reporters. Today's guest is Dr. Michael Ryan, Senior Vice President of Development with the Geisinger Health Foundation, interviewed by Joe Sylvester.
The Sunbury Motor Company.
Austin Martin, Kia Elite Sales Consultant, Maranatha Christian School.
Amber Wren, Certified Hyundai and Lincoln Sales Consultant, Sealands Bavaria High School.
Ian Chikuski, Certified Ford Sales Professional, Mount Carmel and Shamokin area.
Christopher Stengline, Ford Certified Sales Consultant, Sealands Bavaria High School.
Tom Mertz, fourth generation owner, Sunbury Motor Company, Shikellamy High School.
A tradition of trust since 1915.
Welcome to One-on-One. I'm Joe Sylvester, and we're here with Dr. Michael Ryan. He is a pediatrician, specializes in infectious diseases, and he's also a Senior Vice President of Development with the Geisinger Health Foundation. Welcome, Dr. Ryan.
Thanks, Joe. Great to be here.
First of all, I guess you've been involved with the Children's Miracle Network, and of course the hospital. You were one of the people that helped start it, I believe. Before Geisinger was involved in the Children's Miracle Network, that was prior to the hospital, right?
Yeah. Actually, I came here in July 1st, 1980. So I've been here almost 39 years now. And I was actually the 10th specialist hired. We had about 3 general pediatricians at the time. And we all did general pediatrics. Then in 1984 was the first year that we got involved with Children's Miracle Network. Okay. And so this is our 35th anniversary of being involved with CMN. 1989 we started planning the Children's Hospital. And then 1994 was when we moved into the Children's Hospital. So this is our 25th anniversary of the Janet-Weis-Childrens Hospital and the 35th anniversary of Children's Miracle Network.
What was your involvement with the Children's Hospital when it first started?
In 1994, I was a pediatric infectious disease specialist at the time. I had been just appointed vice chairman of pediatrics. And so I was involved with day-to-day operations but primarily I was a practicing pediatrician, pediatric infectious disease person, saw patients and took care of patients primarily.
Okay, and how did it come about, the construction of the
Children's Hospital? Well, actually, we started talking about the Children's Hospital in about 1987. Dr. Tom Martin was chairman of pediatrics, our long and distinguished chairman of pediatrics. And 1989, he went to the board, the Geisinger board, with a proposal for a children's hospital. Sig Weiss and Janet Weiss very much got behind it and supported it a great deal. And Dr. Hood also got behind it and supported it a great deal. Started fundraising, and they said, if you get $26 million, we'll let you build the Children's Hospital. And so we went out and helped raise $26 million to build the Children's Hospital. It opened December 14th, 1994.
No small feat.
It was no small feat, especially when you consider 1994. I mean, a children's hospital for $26 million is a huge bargain. Hershey just built a children's hospital a few years ago, and it was over $200 million. Wow. And so we think we got a bargain, and we built it at the right time, just as things were expanding in pediatrics for Geisinger.
Now, the Weiss family, they've made their imprint here on a couple of buildings and all. What's the relationship been like with the family? Well,
actually, Janet Weiss, up until Janet Weiss died, I would take her out to lunch with Carol Tevis twice a year when we'd have lunch with her. And she shared with us the original story of the Children's Hospital. I guess Sig Weiss came home from the board meeting in 1989 and kind of said, you know, those crazy pediatricians want to build a children's hospital. I'm not sure they need it. And Janet spoke up and said, yeah, they need it, and we're going to support it. Typical Janet Weiss when you get to know her. And so Janet and Sig donated a significant amount of money to get the hospital going and continued to donate money. Even up till this day, we have trusts that Janet and Sig left us that we still get money from every year. So they were incredibly benevolent and very philanthropic and wonderful, wonderful people.
How much has the Children's Hospital grown?
It's grown a lot, yeah. I mean, the hospital itself is still the same walls we've built, but we've remodeled and we've reshaped a bunch of things in the Children's Hospital. I mean, originally when we opened up, I think we were 79 beds, and now we're 91 beds. And most days we're pretty full. You know, most days in the Children's Hospital, we usually have kids waiting to get in or get a bed. And so it's evolved, and we're continuing to see more and more patients and take care of more and more patients. As we've evolved over the last 25 years, pediatric programs and obstetrical programs around us have basically stopped taking care of kids, and many of them have stopped doing deliveries. And as that happened, you know, deliveries came here and the pediatric patients came here. And so our numbers have increased.
What would you, your wish list, I guess, what would you like to see added to the hospital?
Right now, I mean, if you look at our Children's Hospital, we've tried to keep it as fresh as possible. We've just got new furniture for our Children's Hospital lobby and new shades down there. We're always painting things and redoing things. We replace the floors and we replace some monitors and TVs and things like that. You have to keep up with a facility like this, and it's expensive to do that. You know, for instance, when we replace the TVs, these are just standard 27-inch TVs. You know, you can probably go to Walmart and buy them for under $200. You know, when you get TVs for in a hospital, they have to agree with all your electrical panels and what you do, and they were somewhere in the neighborhood of $1,200 to $1,500 per TV. So it's expensive to replace all these things. Yeah. And monitors don't last forever. You have to get new monitors and new IV pumps and new equipment. And so you really have to keep up with all these things, and it takes a while to do this. So, but the one place that we've grown, and it now to me looks outdated, is our neonatal intensive care unit. When we built our NICU back in '94, the concept was an open concept. Mm-hmm. So you wanted sightlines so you could see all these babies and keep track of everything. And shortly after we built that, the model changed, and all newborn intensive care units now are individual rooms. So we recently did a tour of 6 NICUs in Pennsylvania, wonderful NICUs, one in Delaware at DuPont, and they're all private rooms now. And so my wish list is a new NICU with all private rooms and a brand new facility. Our NICU generally runs a census of, it only holds 41, and we're generally pushing up against that census on most days of the week. Part of that is because our obstetrical business is booming. But you know, we do have a lot more high-risk patients who are referred to us every day than what we previously got. Again, obstetrical units around us have gone out of business. Berwick has gone out of business. Sunbury doesn't deliver. Lock Haven doesn't deliver. And then the high risk, we see a lot of high risk mothers, and they get referred in. And so we're going to probably do close to 2,000 deliveries this year, and 1,000 of them are considered high risk. And so when you're doing high risk, you have to have a neonatal intensive care unit. We need a modern neonatal intensive care unit. So that's tops on my wish list. Yeah. The second thing on my wish list would be a pediatric emergency room.
Oh, right.
Yeah. Over the years, you know, we've taken good care of our kids in the emergency room, but now the state of the art has evolved, where most children's hospitals, almost all children's hospitals, have a dedicated pediatric emergency room. And we have pediatric emergency room physicians who now staff our ER, but we're looking for a dedicated space. We have some space that's going to become available to us later this year, and we are going to make that into our pediatric intensive care unit. But our ER, if anybody's ever been in our ER, it's not a pretty sight, and we do the best we can. They do terrific work. They take great care of patients, but we would like to have a new, modern, up-to-date adult ER, and as well as a new, modern, up-to-date pediatric ER.
Okay, that's next on your wish list.
That's the second thing on my wish list. Many people would put that ahead of my NICU, but you know, we certainly need both. Yeah.
You were involved with the Children's Miracle Network for a long time. Are there cases or kids that you remember the most?
I do remember a lot of the kids. I always remember our first miracle kid. Our first miracle kid, probably not many people remember this, his name was Miracle Mike. And he had gone for a ride with some cousins in a car who had just gotten their license, and there was an accident. The car rolled over. Everybody walked away from the accident but Mike, who had pretty severe head trauma. He was life-flighted here from State College. He spent 3 weeks comatose in our intensive care unit and had a traumatic brain injury. and has made a miraculous recovery. He's now a normal functioning adult. In fact, this past year, Miracle Mike, he had gotten married a couple years ago, and Miracle Mike had twins that were premature and ended up in our NICU. So talk about the circle of life. I mean, here's a guy, we saved his life back in 1983, and now he's back with twins, and we helped take care of the twins. They were spectacular. And of course, Mike's wife is a spectacular person too. And we saved the babies' lives too also. So it was a real joy to see him back. So, but I remember so many of our miracle kids. They all stand out. I always wonder how we get such great kids every year, because there's all a great story involved in all of them.
Do you keep in touch?
I keep in touch with a lot of them. Yeah, a lot of them were patients of mine, and a lot of them are people that I see in my travels and communications, and a lot of them send me cards and notes and letters and keep me updated on what's going on in their lives, graduation notices and things like that. So we actually have one of our pediatric residents today was in our neonatal unit here 26 years ago. Actually, she was premature along with her twin, and they did fine. They spent a couple months here recovering from prematurity. She's now a pediatric resident here. And we would love to have her someday be on staff as a general pediatrician. She's a wonderful person and a great role model. And here's a tremendous example.
Talk about full circle.
Yeah, it really is. The thing about neonatology, if you go back to August of 1963, Patrick Boulevard Kennedy was born. I don't know if you remember the Kennedy baby. He was born to Jackie and President Kennedy at the time. He was born early at 32 weeks. He weighed 4 pounds, 10 ounces. He lived 39 hours and died. And I was recently with Megan, who works for W&L Subaru, one of our favorite places. And she relayed to me that she had been followed at another hospital, and she wasn't feeling good, and she went into the other hospital to see how she was doing, and they put a monitor on her. She was in active labor. They checked her, and she was about half dilated, and they said, "You need to go to Geisinger to deliver." And so 32 weeks, fortunately she called, and we had a bed here. She came down. She delivered a 4-pound, 3-ounce baby a couple hours later. And our neonatal intensive care unit team acted like, this is the biggest kid we've seen in a long time, The kid was on respiratory support for less than 24 hours, spent 2 weeks in the NICU, and then went home after that. So look at the difference, from 1963 to this was 3 years ago. What a difference neonatology has made in the lives of them. It's a spectacular difference, and our NICU is just a wonderful place to be. And if you have to be there, we provide outstanding care.
Good. The Children's Hospital, obviously, you face a lot of difficult cases, some serious illnesses, cancer, and things like that. And there must be a lot of pressure or stress on staff. How do they cope with that? Or
it's sometimes
too much.
Sometimes it does become a little overwhelming. I had a situation not too long ago where a patient was transferred in. They had been operated on elsewhere, and they got transferred in. And the kid was really still sick. The operation didn't work, and I was called in to consult on the baby, and the mother and grandmother were there. And I said, "Well, I think your baby has this infection." And the grandmother says to me, "You better be right." I think that's the most pressure I've ever felt. As a grandparent, I have 10 grandchildren. As a grandparent, you know how important grandchildren are. Yeah. And for a grandparent to say, "You better be right." Yeah. Fortunately, I was right.
No pressure there.
Yeah, but you're right. So we do run into a lot of pressure, and things don't always go the way we want, and don't always turn out the way we want. But majority of times it does turn out the way we'd like it to, and things do go well. But it can be a lot of pressure.
Yeah. Is that what keeps the staff going, the successes?
It does keep you going, especially in some of our intensive care units, our neonatal unit, our pediatric intensive care. And for me personally, I've taken care of a lot of kids over the years that I've been here, and to have them come back and say thank you. I'm now a lawyer, I'm now a doctor, I'm now a pharmacist, I'm now a nurse, I'm now a newspaper reporter. It makes me feel good that I entered into some part of their life and helped them along the way. So most of the time, physicians don't stop and think about that. It's like, next case, come in, let's get going. They don't take time to enjoy or smell the roses, as we say. But once in a while that happens, and you do feel gratified by what you're doing. And me as an old timer now, looking back on my career, I remember a lot of kids that we did help and we did move along and we did do good for.
Good. Are you seeing an increase in childhood cancer cases?
Not really. Childhood cancer has been pretty constant in our area. I mean, we see somewhere in the neighborhood of 40 to 50 new children every year with cancer. Now, that gets cumulative as you start adding these up, because it's not just a year. You follow these kids for a long, long time after they've had. And a lot of the chemotherapies take more than a year or two to do it. But, and that's been a fairly constant number. Acute lymphocytic leukemia, or ALL, is far and away our most common. But we do see a fair number of brain tumors. We see 5 to 10 brain tumors every year. And, but it's been a fairly constant number. We'd like it to go down. We'd like it to be nothing. And we hope that someday it will be, but it's been a fairly constant number. We do see some increases in different diseases, though. One of the numbers we see a lot is diabetes, and also bowel disease, Crohn's disease, and ulcerative colitis. These are two what we call autoimmune diseases, and we see a tremendous amount of diabetes, and even what we call type 2 diabetes, which is because of childhood obesity. And so we see some of that down into the elementary school, which is fairly much unheard of.
Well, I was just going to ask why you think there's an increase in that, but other than childhood obesity?
It's childhood obesity,
Are there other causes?
Well, it can be congenital. I mean, we do see diabetics who are not type 1, but are not type 2, but are type 1 diabetics. So they pretty much got it, as a genetic thing. And we'll see those children under a year of age. We average 1 to 2 new diabetics every week. So it's a lot. Yeah. But, the other thing we see a lot of, and this has made the press lately, is attempted suicides by teenagers. We average 1 to 2 attempted suicide by teenagers every week. And these are just the cases that we get sent here for stabilization. They took pills, or they took medicine, or they tried to hurt themselves, and they need medical care. And so we bring them in, we stabilize them, and then we try and get them to a place where they can get some mental health. But I remember when I was a resident back in the 70s here, I don't ever remember, a teenage suicide or somebody trying. I'm sure it happened, but it's weekly now, Joe. It's every week that we see a couple of these kids. Yeah. It's absolutely frightening and staggering.
I know we reported on a lot of those cases.
Yeah.
That they're occurring, and they seem in clusters.
They do seem to be in clusters, and one of the things that sometimes cluster them is publicity. And so we try to keep these out of the newspaper and TV when it happens, because some people get the idea, and then they go from there. And we will see that a lot of times in schools where we have one. We often worry that we have a second. And schools do a great job. They know that's going to happen, and they bring in counselors, and they try and interrupt so that doesn't happen. But it still does happen, unfortunately.
The next question has to do with Miracle Network again. Obviously, it's been a big asset to the Children's Hospital and to Geisinger. But I know you've heard the question that why do they have to even have that? Geisinger makes so much money.
Yeah.
Why can't Geisinger buy all this equipment?
Well, Geisinger would buy all this equipment. This always relates to the question of why should people donate to Geisinger. And I always go back to the beginning of Geisinger. A lot of people don't know this story, but when Dr. Foss and Mrs. Geisinger opened the Geisinger Hospital in 1915, they actually opened it 2 weeks early because there was a typhoid epidemic in Danville, and the Department of Health asked them to open it. Mrs. Geisinger and Dr. Foss had been to Philadelphia, had ordered equipment, and they were waiting for it to arrive by train at the Riverside Station. But 2 weeks early, they weren't prepared for it, and Mrs. Geisinger realized they didn't even have mattresses for these people to sleep on. Wow. And so she called Bob Purcell, who was a board member, lived on the street I subsequently lived on, and said, can you call some townspeople and get us some mattresses? And so the townspeople, the teenage boys, hauled mattresses up to Geisinger in 1915 to get the place open and to get the place started. One of my neighbors he became known as Mr. Bob. He was Mr. Purcell's son. He was 90-some years old when he died, but he would sit on his porch every night on West Market Street and tell this story. But it's the same thing today. We still need people to help us open the doors and keep this place running. Geisinger is a large corporation with a lot of alarms and legs and different places, and pediatrics is not a money winner. We don't, people don't open pediatric units to make money. They open pediatric units to take care of kids and do God's work. And so to get all the equipment and all the services and all the people we need to keep this place running, we have to go out and raise that money and help us. And fortunately, the people in this area have been incredibly generous to us over the 35 years we've been doing the Children's Miracle Network. Without the Children's Miracle Network, we would not have had a children's hospital here. And so it's been a tremendous addition, and it continues to be a tremendous addition for us.
Good. We have to take a short break now, and we'll be right back.
The Sunbury Motor Company.
Austin Martin, Kia Elite Sales Consultant, Maranatha Christian School.
Amber Wren, certified Hyundai and Lincoln sales consultant, Selinsgrove Area High School.
Ian Chakosky, certified Ford sales professional, Mount Carmel and Shamokin area.
Christopher Stengline, Ford certified sales consultant, Selinsgrove Area High School.
Tom Mertz, fourth generation owner, Sunbury Motor Company, Shikellamy High School.
A tradition of trust since 1915.
All right, we're back with Dr. Michael Ryan on One-on-One. But tell me about the superhero ball.
Thanks for asking, Joe. Yeah, well, this is the 25th anniversary of the Children's Hospital, and so we've decided to have a celebration. And so on September 14th, we're going to have the Superheroes Ball. It's going to be a large gala down at the Pine Barn under a tent, and the theme is going to be superheroes. And that's our theme now, and we're doing a lot of things in conjunction with that. One of the things we're doing now is our superhero challenge, and so we're asking people to send us pictures of themselves or their friends or their pets or their gang or their office gang posing as superheroes might pose, and send it in to us at Superheroes Challenge. It's hashtag Geisinger Superheroes. And then we're going to put these things on Facebook and Instagram. For every post we get, we have a person who's going to donate $1 to us. So we'd like to have about 26 million of these posts that come in, so we can raise a lot of money. But it's a chance for people to get involved and show their support for the Children's Hospital and for what we're going to do, and to have some fun with it in the process. So we're hoping it's going to be a big success.
All right. Well, thank you, Dr. Ryan, for taking the time to talk with us.
It's always fun to talk about pediatrics and Geisinger and the Children's Hospital. Thanks for your time, Joe.
Thank you. This has been One-on-One.
Thanks for watching One-on-One. Be sure to tune in next week for another edition.